In today's health check, Dr. Su Laurent, a consultant paediatrician from Barnet Hospital and the Baby Channel's medical advisor, has joined me to talk parents through two conditions which cause a great deal of worry and anxiety: meningitis and febrile convulsions. Hello, Sue.
Hi, Wendy.
Right, let's start with meningitis. What exactly is meningitis?
Meningitis is an infection of the meninges, and the meninges are the coverings of the brain. So, as you can imagine, if you get an infection of that area, you will have symptoms which will include headache, vomiting, and if you're a baby, irritability, high fever, and looking generally very unwell.
And isn't one of the classic symptoms a stiff neck?
A stiff neck, absolutely, and particularly in an older child, the inability to bend the neck forward like that, because everything is so painful, because the meninges go round the brain and then they go down the spinal cord as well, so the whole thing becomes very, very stiff.
And of course, like any illness in a small child or a baby in particular, what as a parent should you look out for?
Well, I think this is very important. This is why children are so different from adults, and we shouldn't treat them just like small adults. In a baby with meningitis, all you may get is irritability, excessive crying, high fever, being off their feeds, vomiting, something which makes you feel, I'm worried about my baby. That's what you might see. So you may not get any neck stiffness at all. They won't be able to say, I've got a headache.
Of course, this is the problem.
This is the problem.
Yes.
And there are two forms of meningitis, largely. If you look at the two groups, one is viral meningitis, which on the whole gets better whatever you do. But the sort that we see more commonly in hospital is bacterial meningitis. And one of these particularly is associated with a rash. And I think many of our viewers will know about the rash, because actually it's very commonly known about. But I think I ought to describe that now to those people who don't know.
Absolutely, yes.
The rash of meningococcal meningitis is a classic rash which looks a bit like a bruise. It looks like there's sort of blood has leaked under the skin, and people may have heard of something called the tumbler test.
That's right.
And what happens is, with a normal rash, if you press, I'm going to just show you with this glass tumbler here, if you press a tumbler over a patch of a normal rash and you look through the glass, what happens is there's what we call blanching. In other words, the redness goes away. But if you put a tumbler over a patch of meningococcal rash, or if you put it over a bruise, it's the same thing. It doesn't go away, because
you can still see it.
You can still see it through the glass. That's what's called the tumbler test. That, if you see a child with a rash like that, or even little tiny red spots that again don't go away, we call them petechiae. They just don't go away.
Could they be on any part of the body?
They can be on any part of the body at all. It's very important to seek medical attention urgently. And in fact, it's so important that GPs who see children like this, with this sort of rash and this sort of symptom, they always carry antibiotics with them, and they will give an injection into the muscle quickly of an antibiotic as soon as they see a child. So the way of seeking help is to go either to your GP if your GP is very near, or call your GP and say, what do I do? Or to go straight to a hospital, or even just to call 999 if you see that rash in an irritable baby or child.
I'm sure we've all seen heartbreaking stories about infants who've had to have limbs amputated. What has the complication been in that circumstance?
Well, I would say one thing we ought to just clarify is that there's meningitis and then there's septicemia. Meningitis is when it just affects the brain, and therefore you'll get a very irritable child, but the rest of the body is usually okay. They may get a horrible rash, but the rest of the body is usually okay. With septicemia, it means that the bacteria is actually in the bloodstream as well. And the rash can become very extensive, can go all around the limbs. It can appear as you're watching a child. I mean, it is terrifying to watch it. And I have seen children who have lost limbs because the rash is so extensive and it's affected the blood supply to such an extent that the only thing that you can do is actually to remove the limb. So it's a very, very serious life-threatening condition, and fortunately for some of the meningococcus we actually now have a vaccine, and in fact all babies now are given, as part of their routine immunisations at 2, 3 and 4 months, are given what's called the Men-C vaccine, and that's against meningococcus type C.
Yes, my children have had that.
That's right. And it means we've actually reduced meningococcal meningitis and septicemia quite considerably. We haven't got rid of it, and the reason we haven't got rid of it is because we're not protecting at the moment against meningococcus A, which is the other reasonably common one, or B, which is much rarer.
Okay.
And that work is going on with vaccines for the other two at the moment.
Actually, I can't let this subject go on meningitis without having a little say of my own, because I actually had meningitis last year, viral meningitis. My only point being is that I'm an adult and I can talk and I can say I have stiff neck, I don't like light, I'm being sick, I feel really, really ill, my head is absolutely killing me. And 2 doctors sent me home. And I think my advice would be, if you really believe that your child is ill, just don't give up.
Yes.
You know,
I think that's a very, very important point, particularly because early on in the illness, you may look relatively well, but you may feel absolutely awful. And sometimes we can be fooled. Older children will have symptoms just like adults. So, and in fact, it's very often the young adults who will get meningococcal disease and meningitis. That's the particularly vulnerable group. It's the students who are all living together in student accommodation that tend to get it. So older children and young babies are the very vulnerable group, but obviously adults of any age, and it's very important that we do take children seriously.
Absolutely, yes. Okay, the second sort of point of worry that I mentioned in the introduction, febrile, if I said that right?
You said that right,
Febrile
yes.
convulsions.
Febrile convulsions.
I know nothing about this.
This is the opposite end of the scale completely in terms of anxiety. These are very common problems which can affect children up to the age of 5. What happens is they have a high fever, they're a normal child, they have a high fever and they have a convulsion, which means generalised shaking all over, eye rolling, often a very funny breathing pattern, and terrifying to watch. Parents will often come in and say, I thought my child was going to die.
Is the child actually unconscious when they're having a
convulsion? The child is
convulsion?
unconscious while they're having a convulsion, which is why they look like they're going to die.
How scary.
It's very scary. It's very scary for the parents, but the reassuring thing is that the vast majority of children will just come out of the convulsion all by themselves. They won't know a thing about it. They'll look around them and think, why is everybody so worried? It will not affect them in the long run. It will not cause long-term brain damage, and it is not epilepsy. And these are the important things to stress to parents. And really, the take-home message with febrile convulsions is they happen when you have a high fever in an otherwise normal child. Not all children will get them, but some children. And really to try and avoid high fevers if you can. So if you notice your child's getting a cold and their temperature's going up, keep them cool. Take off their clothes rather than piling on clothes. You know how often people tend to feel, oh, my child's got a temperature, I need to wrap them up warm.
Yes. Is it the opposite?
You should do the opposite. Actually strip off your child, give them some paracetamol or some Nurofen, whatever it is that you have at home for temperature, and tepid sponge them if they're very hot, but keep them cool.
What are the different symptoms then between that, the convulsion, and you said obviously don't automatically think it's epilepsy.
Yes.
How can you tell?
Well, a convulsion is a convulsion, and so to begin with you don't really know, but if you've got a high fever in an under 5-year-old, and when they come round they're absolutely fine, and they're otherwise a completely normal child, the chance of it being epilepsy is very, very small. You can never say never in medicine, but the chance of it being epilepsy is very, very small, and the vast majority of children with febrile convulsions, if they're fine when they wake up again, and they very often are, they'll have a little sleep then they'll wake up, we know that they're not going to run into any difficulty. They may have them again, febrile convulsions, but it's not the same thing as epilepsy.
How long would a convulsion last for? Seconds?
Convulsion can be seconds, just a few sort of jerking, and before you know it, it's all over. It can be minutes. Very occasionally, children can have prolonged convulsions, and by prolonged I mean more than 20 minutes. And those children will land up coming rapidly into hospital, being brought in by ambulance, and the ambulance has some medicine that can be given into a child's bottom to stop the convulsion. So very often the convulsion will have stopped already in the ambulance by the time they come to see us. But if not, we can give them medication via a vein or via their bottom to stop it in casualty.
Is there any particular position you should get your child into if they're having a convulsion?
Yes, ideally you put them into what we call the recovery position, which means to lie them on their side somewhere safe. So obviously not on a high surface, but just on a flat surface, so it may be on the ground. It's often the best place to put them. On their side, so they cannot inhale their tongue, but never ever put your fingers into a child's mouth who's having a convulsion, or an adult. Many people think it's a good idea because they're worried they might swallow their tongue. All they will do is seriously bite your finger.
Oh,
and I've seen some nasty injuries. They will not swallow their tongue, provided that they're lying on their side with their head on one side.
Excellent. Right, well, I think that's excellent advice on those two very worrying subjects, but I hope you've allayed a lot of fears today. Thank you, Sue, very much.
Thank you.
Thank you.
Thank you.